You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Thanks for listening to the very first episode of the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy, and what I wanted to do for this initial show is just give you a brief introduction of what the show is going to be about, tell you a little bit about my own experiences and how I got into the world of chronic pain, and then tell you what to expect going forward from the show, as well as who may benefit from listening to this show. Today, I'm just going to be talking about my own experiences and a little bit about the show, but going forward, the show is going to be interviews with other chronic pain experts from around the world that I've met, and the goal of it is to give people listening, whether you're in chronic pain or whether you know someone in chronic pain, to give you a better understanding of what exactly chronic pain is. Because one of the things that I've found through my own experiences is that there's a big misunderstanding among people who have it and people who know people who are in chronic pain. And really this show is just to give you a better understanding of what's going on in your own body or in a loved one's body, and to help you better cope and relate to it, as well as find a path to recovery. That, and I've talked to other people from around the world who are in the field of chronic pain. They all kind of say the same things, that everybody has a lot of confusion and fear about what's going on. They don't understand it, and they feel like they're all alone and nobody else understands either. And this really gives people who are suffering from chronic pain a lot of heartache. And so the goal of this show is to give some better information about what goes on when you're in chronic pain so that you understand it better, that your support system, your family members, your friends can also listen to this show and understand a little bit more what you're going through, why you're going through it, why it's different than their own experiences with pain. And then ultimately, the goal of this show is to help you recover from chronic pain if you are in chronic pain, or to help a loved one to get out of chronic pain and to overcome it and to be able to live a happier, healthier, less painful life. So to tell you a little bit more about my own story and how I got into the world of chronic pain, I'm actually a physical therapist by profession. But what I do anymore is very different than what you would expect traditional physical therapy to look like. But that's really where I started out. When I was in high school, I was interested in athletic training, the people who run out on the field and tape people up so they can get back in the game. And that's really what I thought I wanted to do. But talking to my high school guidance counselor, he said, you can do that if you want, but my son's an athletic trainer, and if you want any sort of consistency in your quality of life, in athletic training, you're going to spend a lot of time running around at the mercy of the team, and lots of nights, lots of evenings, lots of weekends, and you're kind of at the mercy of the coach and the team schedule. And, knowing that wasn't really the life I wanted to live, I went into college looking at becoming a sports physical therapist. And I came out of college with an undergraduate degree in athletic training, found out that my guidance counselor was absolutely right, that there is a big time commitment as far as evenings and weekends, and always having to change your schedule at the last minute. And so I went on to go get my doctorate in physical therapy at the University of Pittsburgh. And through that, I learned a lot of good skills that helped me get started. But then I got my first job. I got out of school with a doctorate, a doctor of physical therapy. And, at that time I kind of thought, yep, yeah, I know everything there is to know. I'm going to go cure the world. And that was kind of a naive, probably a little bit arrogant approach at the time. But that ended real quick when you get out into the real world, that you find out you do all the things that you learned in school, and sometimes they work really well. And for other people, they don't work at all. And it really started to bother me that, I'm doing the same thing for these same patients that seem to have the same problems. And some of them are getting better and some of them aren't. And I really wasn't okay with that mediocrity, that, well, yeah, I tried, but I can't help you. Sorry. So I went on to further my education, did a fellowship in manual physical therapy, which is sort of a hands-on approach where you put your hands on people. There's manipulation that you learn. There's soft tissue techniques that you learn for the muscles. A lot of tools and neat tricks that you can use to get people some pretty drastic pain relief, as well as, and I think the most important part of it, is that it really teaches you how to think on a higher level and how to investigate not just the symptoms of a problem, but what are the root causes that are actually causing this problem in the first place, and how can you address those to help people get more of a lasting relief. So that helped improve my practice quite a bit. But to some extent, I was still looking for tools that, hey, I can do this manipulation on people and they get better quickly. And I can find out this movement pattern that seems to be causing somebody's pain, and I can change that. I can educate them and help them change that in their everyday life. And that helps take care of some things. But largely it was still a very biomechanical approach, that it all focused on movement and changing people's movement and the length of tissues, stretching, strengthening, joint mobility, all the traditional physical therapy type of things that work really well. And don't get me wrong, that after that fellowship, I was able to help a lot more people. But there was still this subset of people, these chronic pain patients who have gone from doctor to doctor to doctor, or physical therapist to chiropractor to massage therapist, and just still hadn't gotten the relief. And then I met a mentor that kind of opened my eyes to a whole new world. And I've got to thank her if she's listening. Her name's Cindy Meyer. She's in Indianapolis, and also Sam Kagaris. He's a professor at the was a professor at the University of Indianapolis. And they both really helped open my eyes into the whole new world of chronic pain. That when most people think of pain, they think, okay, I stubbed my toe, I bent down and injured my back, and that sends a signal to my brain telling me, hey, I'm in pain. And the science of that actually really isn't true, but the science of chronic pain has really just exploded in the last 30 years. But some people are still not aware of it, even in the medical community, of the changes in pain science. And a lot of people, both lay people and medical people alike, still think a lot that we have pain receptors that tell our brain, hey, you're in pain when something's injured. And once that injured tissue heals up, that pain receptor stops firing. Well, we actually don't have any pain receptors in our body. We have free nerve endings that basically tell our brain the status of what's going on in our bodies. And, without getting too deep into the science of it, when you're in chronic pain, the message that gets to your brain through your spinal cord is not always reflective of reality. And so it opened my eyes to a whole new paradigm that people who are in chronic pain can have fully healed tissues. There can be nothing injured in their body, and they can still be suffering. And it's not that they're making it up. It's not that they're crazy. It's not that the pain is all in their head. their pain is absolutely real. There's just no or minimal tissue damage that would correlate with the amount of pain that they're still suffering with, and the amount of disability and the amount of mental anguish that they're going through. And so understanding a little bit more about that was extremely helpful. Even with that new understanding of pain science and chronic pain, I still, as is natural for a practitioner, was looking for tools, quick fixes. And around the time, dry needling was becoming very popular. And dry needling is essentially, it's a technique, a tool, so to speak, to help chronic muscle pain, to get knots out of muscles. Kind of like a trigger point injection. It actually uses more acupuncture type needles rather than injection needles. But it's based on the science of trigger point injections into muscles. And that technique has also been incredibly helpful at helping people who haven't been able to be helped in the past. But again, it's a technique. But in going through the education of dry needling, there is a lot more education on pain science and what causes chronic muscle pain, as well as some of the just overall things that go on in your nervous system and in your brain when you are in chronic pain. And whether that's pain that's just lasted 3 months or 6 months or 10 years or 20 years, the science of it is kind of the same, that pain that remains longer than the normal tissue healing guidelines, which in general is about 3 months, that pain is a little bit different in nature than is acute pain that you would think of, like when you sprain your ankle or injure something in your back. So I moved forward in my career, probably about 7 years into practice at that point. And all the while, I was gaining more and more information and being able to help more and more people. But I still kind of felt like I was missing the boat sometimes. And then ultimately, the big eye-opener in my career was sitting down with a supervisor for a review and saying, Dave, you know the research better than anyone else in this company. You understand things at a much higher level. You're much better educated than all of our other therapists, but you don't really relate to people. You don't really listen. And I think it was almost some degree of arrogance that, hey, I've got all this education, all this knowledge. I'm a specialist or an expert, so to speak. You should listen to me. But I wasn't listening at the time. I wasn't listening to the person sitting in front of me, the person that was there suffering and in pain. And I wasn't respecting that, even though I had all this new information, all this science about how pain is not really what any of us had learned growing up, I didn't respect the fact that I was at a different point in accepting that knowledge than other people were. And really, I think the biggest leap forward in my practice was not any degree, not any certification, not any technique, but really the understanding that it's not all about me, that it's about the person sitting there in front of me who has a life, who has a family, who's scared, and who wants to be able to do all the things they used to do before they were in pain, and they can't. And the worst part is that they've gone from specialist to specialist, and they've kind of given up hope that they'll ever be able to do that. And when I really started listening to people, empathizing, understanding them as a person first and not an injury or a patient, but just being able to relate to people and understand what they're going through, it brought my practice to a whole different level. That I wasn't there to serve myself or do a job. I was there to help people. And that's really what sprung me forward in my career more than anything else. There are a lot of specialists out there, and there was a show on TV years ago called House about this just brilliant doctor, but he was a jerk, an absolute jerk. And there are probably, hopefully not too many doctors out there as bad as they portrayed this Dr. House to be on the show. But I think a lot of specialists, they do get involved in some degree of, hey, I went to school for all these years. I know what I'm talking about. You should listen. And I understand it. I was there at a point, but that's just not the way that I prefer to practice anymore. When I first meet someone, we sit down and we have a conversation. I let them talk about all the things that they've either been too afraid to talk about or that no one has just ever taken the time to listen to. And I try to understand them as a person and then say, hey, what do you want? What would you like to get out of seeing me? And then if I can help them do that, I'm happy to help. And if not, I don't feel like I have to be the one to help people. I just want them to get the help. So if I can help, I'm happy to do that. If I feel like, I'm not the best person to help you with this, I'm happy to refer out and send to other people who are going to give that person a better chance of achieving what they want. Because I think that's really ultimately going to make people feel better about myself and about my practice than would me trying to treat people and sometimes being successful and sometimes being unsuccessful. So really now I ask people what they want. I tell them, hey, this is what we can expect if we go forward from here. And then they get to decide. They get to decide if working with me is going to be the best solution to their problem. So what this show is going to tell about is give a little bit more information about chronic pain. It'll slowly help people to understand a little bit more of the education that it took me years to gather and about the science of pain and why some people who suffer from chronic pain, their pain's not consistent. One day they might feel great, and another day they may do the absolute same things and feel horrible. And people often start to tell them, hey, maybe the pain's all in your head. Are you sure you're not just making this up? And they feel isolated. They feel like no one understands. And this helps them to, one, understand and maybe have their family and friends understand a little bit better why their pain is so inconsistent. It's not like, well, when I walk on my sprained ankle, it hurts, and when I don't do it, it doesn't hurt. The chronic pain behaves inconsistently, but the consistency of it is that it's consistently inconsistent. That just being able to recognize that, hey, this doesn't behave the way that we normally expect pain to behave, it's a clue that lets us know we need to take a different approach. An approach that focuses not just on the tissues, but focuses on pain, and focuses on the person, and focuses on the things that may be driving that. Some of those, and we'll go into more detail in this in future shows with our guests, but some of those are anxiety, fear, anger, just repetitive habits that you may not know that you have, thought processes, things you've been told about pain throughout your life. We still need to address the tissues and address the biomechanics, and that's addressing movement is really what I've done my entire practice. It's why my clinical practice is called Movement for Life. That we do a lot with the biological, but we also take into account the psychological factors that play into pain, as well as the way that it limits you socially. And that's really what pain is. It's a bio-psycho-social phenomenon. And it takes into account all three of those parts. It's not just the tissues. It's not just your thoughts. It's not just society. It's a combination of everything. So in future episodes of this show, it's not just going to be me sitting here talking and giving a monologue that I can preach all day, but I'm just one person. And what I'm going to be doing is I'm going to be talking to other pain experts who I've come into contact with throughout the world. And hopefully by doing this, you'll start to see that there's a lot of common themes, that we all hear the same things, whether you're right here in St. Louis, Missouri, or whether you're halfway across the world, that suffering is suffering and humans are humans, regardless of where you live, that there may be cultural differences from one region to another, but there are some universal experiences that we all go through when we're in pain, and especially when that pain goes on longer. And hopefully by hearing some of these stories from around the world and stories about some of these other clinicians, patients, the things that they suffer with, you'll understand that you're not alone, that everything that you're experiencing is normal, that if you're not in pain but you're listening because you have a family member or a friend who's in pain, that you can relate a little bit more to what they may be going through, and hopefully, by that, be able to help them a little bit better, help to understand them a little bit better, and ultimately help them to recover back into the happy, healthy person they were back before they started hurting. So that's all I really have for today. If you do have any questions, feel free to reach out and contact me. My clinical practice phone number, if you're in St. Louis, is area code 314-941-3970, or you can reach me by email at dave@stlpainexpert.com. Thanks for listening, and I hope you tune in to future episodes of the show.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com, or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.